Hi, welcome to What the Health, a different kind of podcast from the original prevention network at EHE Health. It's Joy Altimare. In each episode, I'm going to be your host, and I'm going to welcome leaders from diverse fields to explore why women have such frustrating experiences with healthcare and what can we really do to make real change. It's the only podcast that explores the full scope of these issues, and I hope in depth and from all angles, amplifying the voices of women whose interactions with the system has led them to exclaim, "What the health?" So sit back, relax, and enjoy the show.
Hello, and welcome to What the Health, a new podcast from the original prevention network, EHE Health. My name is Daniel Jacobson, and we are here with Joy Altimare, who's going to be hosting this. Hi, Joy.
Hey, Daniel. How are you?
I'm very good. How are you?
I'm excellent.
So, Joy, tell us what this podcast is going to be all about.
Well, I think it's in the name. What the health? It's really an articulation of what women usually say to themselves when they're entering or navigating the healthcare system. I think what we want to bring to the table are topics that are important to women from when they're younger and they're thinking about how do they navigate having a period to when they're in their mid-20s or 30s or even 40s, navigating having babies, all the way to the end when it comes to like osteoporosis. I like to say this podcast is going to cover topics from cradle to grave. Mm-hmm. And that's important because I think most of the time healthcare for women is only around fertility, how to make babies, how to get pregnant. But there's so many things that women go through that have nothing to do with making babies. Some women don't want to make babies. So we want to talk about everything that concerns women in healthcare, but then also the periphery of healthcare. Mm-hmm. Some of the things that we have to deal with. Everyone has heard about the pink tax. I think you and I were having a conversation earlier where I was saying, yeah, I don't purchase female razors,
right? Yes.
Because they're first overpriced and two, they don't work as if they're not as effective or efficient as a male razor. Mm-hmm. I don't know if that's because you guys are putting them on your face and we're putting them other places. But at the end of the day, there's this thing called pink tax that we pay more for items that are created for both male and female that could basically be unisex. Mm-hmm. And if you look at if you juxtapose that to the fact that we make 76 cents to the dollar, it doesn't seem like the world is really thinking about women first. So we couple the fact that we make less, we have to pay more, and the healthcare system is often leaving us with this phrase of what the health?
Yes.
That's what the podcast will be about.
Great. Yes. And it's going to cover a lot of topics. Like you said, it's not just a narrow look at what's usually considered quote unquote women's health. It's going to be talking about all the ways that women interact with and have experiences with the healthcare system and beyond. What kinds of people will be on as guests? Yeah,
so I'm excited. The first topic, we're going to be talking about employers, what they can do. A lot of people are going back into the office, countered with this great resignation. What are women looking for when we talk about flexible hours, when we're talking about equitable pay? We're going to be having an amazing chief operating officer who will talk to us about what she's done to create an environment and a culture that welcomes women. So that's one of our first episodes. This, as we go through, we'll be talking about, like I said, the pink tax. We'll have an expert on here who actually works with organizations, businesses, to help them look at how they are pricing things, how they are looking at marketing. So taking its marketing spend to how women are introduced to products. Yeah, we'll be talking about a lot of things. I'm excited because we'll obviously talk about fertility and we'll have a specialist on for that. But we'll also talk about some of the comical sides of just going into the OBGYN and asking them for your medical record electronically and how that can sometimes be difficult. Or, maybe we'll talk about the difference between a 3D and 4D mammography and when you need that. So we'll get very deep into some recommendations or perspectives from a clinical side, but then we'll also have lighter guests to talk about just the things that we just cannot believe we're still dealing with it as women as we go through the healthcare system.
Right. Exactly. Yes. A big part of the podcast being planned was that we wanted to make sure that it was going to be not just the clinical or medical side of healthcare, but also social, also cultural, and also just making sure that marginalized voices or voices that aren't usually heard on podcasts get to be heard and that everyone's experience gets some airtime.
Yeah, for sure. I mean, there'll be topics around Black maternal health and as it relates to other women of color and their challenges with the healthcare system. We'll definitely have physicians of color on the podcast to talk about some of the things that they would suggest for us to do to advocate for ourselves when we're in that clinical setting. We'll be talking to the LGBTQ plus community and things that they should be thinking about or how the healthcare system can better serve them. I think you're right. What we really want to create is an atmosphere and environment where women know that they're not alone.
Yes.
If you've ever been on any Reddit or any page, any group, social group page, what it does is it's, as you read through the comments, it often helps you feel like you're not alone. And so you can get out of your head and start looking for solutions.
Yeah.
So while this will be, a quick 20, 30-minute session, we hope that it helps women. We leave them with some educational advice and support, but they understand that they're not alone, that what they're experiencing is not singular to just them. That way they can start to think about solutions. Because the first time it happens, you usually think this is not normal and it's just me. It's not just you. Mm-hmm. Let's educate ourselves. Let's arm ourselves. Let's advocate for ourselves. And then let's make decisions that can impact the entire world. At the end of the day, we have a choice. We live in America. You do not have to go down one path. And I think if we start as women consumers, we use our voice, but also we use our ability to purchase to impact the way that businesses, employers work with us, think about us, then we'll start to see real change. Yeah. So I'm excited about the podcast. It won't be so deep all the time, but we will start to hopefully see a movement happening where you see more pharmaceutical companies or more pilots happening in the healthcare system that involve women issues. That would be an amazing thing. Because I will say, and I'll leave it on this note, at the end of the day, if my 7-year-old daughter is having the same conversations and same challenges around her healthcare access, or how she has to advocate for herself when she's giving birth, if she's having those conversations when she's my age, then I will have failed. Yep. So we want to make sure that we're leaving the generations behind us in a better place.
Absolutely. Yes, it's definitely going to be an empowering, relatable discussion on a lot of different things, and we're looking forward to it. The first full episodes will be coming shortly, and we hope everyone will join us for what should be some great discussions.
Yep. Thanks, Daniel.
Thank you, Joy.
Hi, it's Joy Altimare here, host of What the Health. Thank you for listening this week. We hope you enjoyed it. We hope you like what you heard and you subscribe, spread the word, and give us a good rating on Apple, Spotify, or whatever you're listening to. You can also subscribe to our YouTube channel for video of every episode, plus lots of other useful content. For more information about what EHE Health and preventive health are all about, visit us at ehe.health. Until next time, what the health?